My name is Dr. Walker. I am an opioid addiction physician at Suboxoneclinics.com. Suboxone Clinics is one of the biggest opioid addiction clinics in the United States. Let's discuss opioid overdose and prevention strategies. Opioid overdose is a serious and potentially fatal medical emergency that occurs when an individual takes a higher dose of opioids than their body can handle. Opioids are a class of drugs that include prescription pain relievers like oxycodone, hydrocodone and morphine, as well as illegal drugs like heroin. Opioid overdose can lead to respiratory depression, unconsciousness and death if not treated promptly. Prevention strategies for opioid overdose are crucial to address the opioid epidemic and save lives. Here are some key aspects of opioid overdose prevention. Education and awareness. Public education campaigns can help raise awareness about the risks of opioid use, signs of overdose, and the importance of safe opioid use. Healthcare providers should educate patients about the proper use of prescription opioids, potential risks, and how to recognize signs of overdose. Access to naloxone. Naloxone, also known by the brand name Narcan, is a medication that can rapidly reverse opioid overdose by restoring normal breathing. Naloxone should be readily available to opioid users, their friends, family members, and first responders. Some states have implemented standing orders or pharmacist-prescribed naloxone to increase its accessibility without requiring a doctor's prescription. Distribution programs. Community-based naloxone distribution programs provide kits to individuals at risk of overdose or those likely to witness an overdose. These programs may be implemented in pharmacies, harm reduction centers, and other community settings. Good Samaritan laws. Many jurisdictions have enacted Good Samaritan laws that protect individuals from legal consequences when seeking medical help for someone experiencing an overdose. These laws encourage people to call emergency services without fear of being prosecuted for drug-related offenses. Medication-assisted treatment, MAT. MAT combines behavioral therapy and medications, for example methadone, buprenorphine, naltrexone, to treat opioid use disorder and reduce the risk of overdose. MAT can help individuals manage cravings, stabilize their lives, and reduce the likelihood of relapse. Prescription drug monitoring programs, PDMPs. PDMPs are electronic databases that track controlled substance prescriptions to prevent doctor shopping and identify individuals who may be at risk for overdose due to multiple prescriptions. Safer prescribing practices. Healthcare providers should follow evidence-based guidelines when prescribing opioids, including assessing the patient's risk of overdose and considering alternative pain management options. Treatment and support services. Expanding access to addiction treatment services, counseling and mental health support can help individuals struggling with opioid addiction. Harm reduction strategies. Needle exchange programs, supervised injection sites, and other harm reduction measures can minimize the risks associated with opioid use and decrease overdose rates. Community engagement. Engaging with communities affected by the opioid epidemic is essential to tailor prevention strategies to local needs and foster a supportive environment for recovery. Combating opioid overdose requires a multifaceted approach involving healthcare professionals, policymakers, communities, and individuals. Effective prevention strategies focus on education, harm reduction, increased access to treatment, and addressing the root causes of opioid addiction. If you want updates on opioid addiction recovery, please subscribe to our channel. To make an appointment, please schedule on Suboxoneclinics.com.